AMA Congress in Atlanta, Georgia, USA, and have the pleasure and satisfaction to welcome Dr. Thomas Corbin from West Palm Beach, Florida.
Thank you so much.
Dr. Tom, how are you?
Real good, thank you so much. I'm happy to be here.
So we would like to talk with you about why do you prefer to use laser, low-level laser therapy, class 3B, in case of acupuncture?
Okay, I found that in America, many of us feel that having more power is going to equal better results. And when I started to bring lasers into the United States, and I started to import lasers in the late 90s from Russia, I was of the same mind. But the more research that I read, it seemed that the people that were doing the most laser work were actually using smaller power with more frequencies. And so as you read more research, you see that really the key that seems to hold the best healing is, do you have the appropriate frequency to actually treat that particular problem, depending upon what type of problem it is. Because not everything is going to heal the same way. A neurological problem may be different than a musculoskeletal problem, that may be different than an organ problem. And so the greater the frequency, the more diverse the frequency, the better chance I have of actually getting better results.
Very good. Thank you very much. Next question. What would you prefer when you think about that we are dealing with continuous wave and pulsed wave lasers? What is your preference?
Well, I like to use, or I like to have the ability to use both of them. I think that, again, if you're giving the brain a continual signal, I don't believe you're going to get the healing that you're going to get is if you confuse the brain. When you have a chronic injury site and the brain is getting that continual signal from that chronic injury site, what kind of healing do we get? Normally, you don't get good healing, otherwise it wouldn't be a chronic injury. So my role as a therapist is to continually try to teach the brain something new. By varying my treatment, I believe I get better healing.
Very good. And you mentioned also something which drew my attention. You mentioned frequencies. So when you talk about frequencies, what would you recommend to your colleagues, for example, in the United States, Dr. Tom, when you're talking about frequencies? What is your major thought and your preference in that case?
I understand. I think first and foremost, there has to be an education as to what frequencies are. And second, you're going to have to, and I come from a background of auricular medicine, where you're going to use the 7 frequencies of the ear to treat the ear. Well, if the ear is truly a microsystem, if it is a microsystem of the macro system, and I'm using 7 frequencies on the ear, then I must have to use those different frequencies on the body. And again, having the education that is afforded by some of the European techniques, doing your own research. There's an awful lot of research right now on the internet. Look to the colleagues that do the most work with lasers. I know when we were thinking of presenting a program in the United States to teach laser, they took me to Germany. Why? Because the German orthopedic doctors implemented laser in their orthopedic wards better than any other doctor that I'd seen anyplace else in the world. So you want to go with the people that seem to have developed the greatest ability with that particular tool. And so that's why I believe in lasers, and I believe in using the frequencies with the 3B rather than using just powerful lasers to try and treat the area as quickly as possible and get out and go to the next job as quickly as possible.
Very interesting what you're saying, and there are 2 more words. I listened to what you were talking about, especially auricular and general acupuncture. So what is your avenue you're preferring, auricular or both, or only one of both, body, ear?
Okay, I know that in many cases it is taught by many different teachers that if you use the body, you can't use the ear. If you use the ear, you can't use the body. In the 20 years experience that I've had, I have often found that by diagnosing with the ear, using the ear, and ancillary body points, I get my best result. Now, in order to really diagnose with the ear, you have to know some of the techniques that are learned in the German system. And that, I believe, is my role here, to bring that system, as Dr. Strittenmatter and Dr. Barr have tried to do here in the United States. But I believe that if you do use that system, you're going to find that you're going to get a better diagnosis and longer lasting healing. So I use both of them.
Okay, understood. So this leads us, of course, to the next question. Which of the lasers you would suggest, for example? Because here on the AAMA we see a couple of different ones, but what would you say, what does a customer need? Because you said frequencies, you need not power, and there might be some more criteria of we would like to listen to, what you would also like to recommend to your colleagues.
Excellent. I think it's an excellent question, and I think a lot of it has to do with what type of practice you have and who it is that you see in your practice and what essentially you can afford. You don't want to go in by buying a Lamborghini in the very beginning. You may start with a Corvette or some other smaller sports car. So for many of my colleagues, I would say to use a laser that could be used equally on the body and the ear. Something like the laser pen, which I'm holding in my hands, which has all of the frequencies, is easy, portable, can be used on the body, can be used on the ear, has sufficient power so that you're not standing over a point all day to get the appropriate amount of joules or energy in that point, as basically evidenced by prior research from the World Laser Society. That basically would be the laser that I would say to my colleagues to start out with. After a while, you're going to definitely go into something like this device here, which is the brain. And that brain, you can add different lasers to, so that it's an all-inclusive system. You have the ability to bring in some of the 90-watt super pulse laser, you have the ability to bring in laser showers, or you may even bring in something like the light needle. And those devices there, which you can build on depending upon what your pocketbook will allow, are definitely devices that are well thought out. Because they understand that you have to be able to marry a device. You just can't buy a new device and throw the old one away. Here you have something you can build on, which is, I believe, a great idea.
Absolutely. And now, of course, before I take too much of your time, I would like to have a simulation. Imagine I'm a patient. Okay. Imagine I have toothache. Okay. And imagine also you have already diagnosed and want now to treat my pain. How would you do it?
Well, as an acupuncturist, I probably would stay away from the mouth. I know my colleagues in Germany would do actually laser in the mouth. So I personally would have you sit down comfortably, put it on the appropriate frequency for the ear, in that area of the ear, and simply treat that area. I would treat it in a continuous way, and then I would also treat it in the frequency. And the frequency in this particular area is going to be frequency C for the jaw. And then basically, after treating that, I'm going to treat both the front and the back of the ear. The good thing about it is now I have the ability with this laser to also treat the master point for the face, which is large intestine 4. And the same thing could be true there. I can take that frequency and also treat that, or I can use a continuous wave. And I'm going to up my joules rather than 4 to 6 probably on the body. And so now I've put together a treatment for the body and the ear, which I believe is my specialty, or what I find to be the best healing for my patients. And I've concentrated on pain for the last 20 years.
Very impressive. So I hope I won't have tooth pain the next time, because I hate it. But when it were the case, I know where I go to Dr. Thomas Corbin, of course.
Okay, just remember one thing. No matter, even if I get rid of it, you still must go to the dentist.
Okay, fine. Yes, I will, of course, appreciate that. Thank you very much.
My
It was a
pleasure. Thank you so much.
Okay, thank you. All the best.